Let's take a peek into the life of Sam, a 7-year-old who loves fun and adventure. He's just like other kids. He likes to play, explore, and ask a bunch of questions. But Sam is different. He's got so much energy, and he always finds it hard to sit still. As soon as the sun rises, Sam is awake, his mind full of thoughts and ideas. He's always on the go, moving from one thing to another, even before breakfast. His parents are amazed by his high energy, but also worried because he can't sit still. Breakfast is a crazy time. Sam finds it hard to concentrate on eating because he gets easily distracted. A cereal box, a bird outside, the morning radio, everything catches his attention. Sam loves school, but in his own way. He sees school as a place full of colors, sounds, and movement. Being in the classroom is tough. Sitting still feels like a punishment for him. His legs shake under his desk, his fingers tap, his mind runs. Paying attention, focusing, doing tasks. These are big challenges for him every day. After school, doing homework is another struggle. Focusing on just one thing at a time feels impossible. His mind is like a race car, moving so fast, and it's hard to slow down for the careful work that homework needs. Remember, Sam isn't being difficult on purpose. He's not out of control. He's not a bad kid. He's a child with ADHD, a condition that can make a person super active, easily distracted, and impulsive. Sam's behaviors, his struggles, they're all signs of ADHD. Sam's day might seem stressful, not just for him, but for those around him. But is this really ADHD? Let's find out. ADHD, short for Attention Deficit Hyperactivity Disorder, is a brain condition that affects adults and kids. It's not just about kids being super active or finding it hard to sit still. It's a real health issue that can make daily life tough. To really get ADHD, let's hear from the experts. According to Dr. Russell Barkley, a big-name authority on ADHD, this condition is marked by ongoing inattention, hyperactivity, or impulsivity that's more common and serious than usual in people at a similar age or development stage. ADHD isn't a one-size-fits-all thing. There are actually 3 types of ADHD, each with its own symptoms and hurdles. First, there's predominantly inattentive presentation. People with this type of ADHD mainly struggle with staying focused, paying attention, getting organized, and following instructions. They might seem forgetful or easily sidetracked. Then, the predominantly hyperactive impulsive presentation. This type is marked by being restless, acting on a whim, and finding it hard to stay still. These people might seem to always be on the go, and they may find it hard to do tasks that require waiting. Lastly, we have the combined presentation, which is a mix of inattentive and hyperactive impulsive symptoms. This is the most common type of ADHD, and people with this type have big challenges with both attention and hyperactivity impulsivity. It's crucial to remember that ADHD isn't about a kid being bad or rowdy. It's a health problem with a biological basis, which means it's not something a kid chooses or that can be fixed just by discipline. Understanding ADHD is the first step to helping those who live with it every day. It's about empathy, patience, and creating a space where they can succeed. So, you're wondering, how do you know if a child could have ADHD? It's a tricky question that lots of people ask. Let's break down the signs that might give us some hints. One of the main things you might notice is that they struggle to concentrate. Whether they're doing homework or listening to a story, kids with ADHD can find it hard to stay focused. It seems their thoughts just drift away, and they can't stick to the task. Then there's being really hyper. Sure, all kids are full of energy, but kids with ADHD seem like they're always on the move. They find it hard to sit still and might be wriggling, fidgeting, or running around when they shouldn't be. This isn't about a kid who's just energetic. It's about being so active that it sets them apart from their friends. Another big sign is impulsiveness. Kids with ADHD often do things without thinking about what could happen next. They might shout out answers in class, interrupt people, or have trouble waiting their turn. This can make it tricky for them to fit in socially. Forgetfulness is another clue. Kids with ADHD might forget to do everyday things, like pack their school bag or finish their work. They might also lose stuff a lot, which can add to their problems. Finally, there's having difficulties with following instructions. Kids with ADHD may not understand or follow instructions, not because they're being naughty, but because their mind has wandered off again. It's normal for all kids to forget things, to fidget, or to act without thinking sometimes. It's only if these behaviors keep happening, cause problems and really affect their life, that it might be more than just usual kid stuff. Figuring out if a child has ADHD isn't as simple as taking an online quiz at home. It is a good idea to meet with an expert like a doctor, psychologist, or psychiatrist. Getting your child diagnosed with ADHD might take some time. It involves having a detailed checkup that looks at how your child behaves in different places. The experts will want to know how your child behaves at home, at school, and when they're out playing with friends. An important part of figuring out if your child has ADHD is comparing how they behave to how other kids their age normally behave. Kids with ADHD often find it harder than their friends to stay focused, control their behavior, and keep things tidy. All kids can act like this sometimes. What makes kids with ADHD different is how often or how intense does it affect their daily life. The experts might use different methods to learn about your child's behavior, like behavior scales, watching them, and talking to them. They might also look at their school records and work. All this information helps to understand your child's behavior and see if it fits the ADHD criteria. Why is the checkup so detailed? Well, because ADHD can often come with other conditions like learning problems, anxiety, and depression. A detailed checkup can help the experts be aware of other conditions that could impact your child and create a treatment plan that takes care of all your child's needs. Lastly, remember, getting a diagnosis isn't about labeling your child. It's about understanding what they need and how best to help them. It's about helping them do well despite any difficulties they might have. Getting diagnosis is the first step towards understanding and dealing with ADHD. ADHD can be tough, but there's lots of help available. Exploring ADHD might seem a lot, but remember, you're not alone. There are endless sources of help to understand and manage ADHD for kids and their families. Let's talk about books first. There are many simple-to-understand guides that can help you get a clear picture of ADHD. Books like Taking Charge of ADHD by Russell Barkley or Driven to Distraction by Edward Hallowell give important information about the condition, how to handle it, and ways to cope. They give you a ton of knowledge that can make you feel more confident in helping your child. In our digital world, websites can be a goldmine of information and support. Websites like CHADD, Children and Adults with Attention Deficit/Hyperactivity Disorder, or Attitude Magazine have articles, webinars, and Q&A sessions with experts. They give handy tips and tricks for dealing with ADHD in everyday life. Getting support is another great help. Connecting with others who are dealing with the same things can give comfort, reduce feelings of being alone, and open up opportunities for sharing tips and success stories. You can find local ADHD support groups in hospitals, schools, or community centers. Online platforms also have a lot of support group options, from forums to social media communities. Learning is a powerful tool. The more you know about ADHD, the better you can help your child. This can lead to better self-esteem, relationships, and success in school and life for your child. Help is also out there if you are looking for professional support. Therapists, coaches, and educators who specialize in ADHD can give personalized strategies and tools for dealing with ADHD. It's okay to ask for help. This is less about curing ADHD and more about how to manage it effectively so that you and your child can have a less stressful life. Take a deep breath, arm yourself with knowledge, and remember, you've got this. If you found this video helpful and supportive, don't forget to give it a thumbs up. Your likes encourage us to create more content like this, to help you and many others. Also, if you haven't already, subscribe to our channel for more videos on mental health. We're all in this together, and your support means a lot. See you in my next video.